National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, my name is Dr. Jonathan Beatty. I'm a naturopathic doctor and a health expert here at Nationalnutrition.ca. Today we're going to talk all about anemia, what causes it, and what are some of the things you can do to help manage your anemia. So there's a couple of different reasons you can have anemia, but first let's understand what anemia is. Essentially, anemia is a lack of proper blood cell production. It can be characterized by what we call microcytic anemia or small cell anemia, or macrocytic anemia or large cell anemia. There's two subtle variations with them. One, the microcytic is typically what we would call an iron deficiency anemia, whereas the macrocytic is typically considered a B12 deficiency. Or sometimes it's referred to as pernicious anemia for those of you, just so you can differentiate which one you may have if you're having a discussion with your doctor. So when you have anemias, the first thing to do is, of course, understand which one you have, because treatments are going to vary between the two. But it's also important to understand which one you have so you can try and figure out what's creating it in the first place. Obviously, iron deficiency anemia, much more common in menstruating women. Reason, of course, is monthly blood loss, and with this comes a loss of iron. And if you're not replacing that iron adequately, you'll start to develop microcytic anemia, and this is characterized by a lack of hemoglobin production. So what your body does is it starts to try and produce more cells, but because it can't make hemoglobin, it produces more of these really small cells, and you start to experience things like fatigue. The reason behind this is that your blood can't carry adequate oxygen. Some of the other symptoms you can typically see are actually dermatitis or skin rashes with an iron deficiency anemia. You can have easy bruising, you can have hair loss, you can have brittle nails. So there's a number of different ways this can manifest. It's typically easily caught with a simple blood test. Your doctor can test you. They can measure your red blood cells. They can measure the size of the red blood cells. They can also measure the hemoglobin content. And they can actually test for something called ferritin, which will give them a good indicators to what your iron stores are like. I typically recommend that you try and get your ferritin score above 80. The reason behind this is that that shows that you have absolute iron adequacy, and it's iron that's required to actually form hemoglobin, to carry oxygen, to nourish cells, and again, avoid all the symptoms of the anemia. If on the flip side your problem is a B12 deficiency, again, you're going to be able to get that tested by your doctor. They can measure your B12. Actually, the best test is to measure something in your body called methylmalonic acid. It's a metabolite in the body, and it gets elevated when your body doesn't have enough B12 to remove it. And so that's one of the best indicators as far as a functional B12 level. Because even though you have adequate B12 as per a blood test, and sometimes your methylmalonic acid levels may be high, showing that although your blood test shows adequacy, functionally you're not there, and your body doesn't have enough B12 for its normal function, normal physiology. And that, of course, leads to a disease state, typically, again, characterized by fatigue. The interesting thing with a B12 deficiency, the major difference symptomatically, is actually the development of a slight tremor, primarily in the hands and fingers. And this is because B12, in addition to being needed to make blood cells, is also needed to insulate nerves. And what ends up happening is you do start to develop nerve damage, and it starts with what can be characterized as a tingle in the fingers, as well as a mild tremor. If you notice that onset, definitely go to your doctor to get diagnosed as to why the tremor is developing, and B12 may be a very simple solution for that. So if you have anemia, of course, the other things you need to address are your diet, because oftentimes it can be dietarily related. Inadequate consumption of iron and or B12 can cause anemia. The interesting thing actually is that an iron deficiency can mask a B12 deficiency and vice versa. So that's why it's so important that you get diagnosed and get treated appropriately. So dietarily, some good sources of iron. For those of us who eat meat, liver is probably one of the highest sources of iron. If you don't consume animal products, some of the other places you can go are your leafy green vegetables. So of course the good old classic Popeye, super powerful forearms after he eats his spinach. That's because spinach is a great source of iron and of course fortifies the body with energy and strength. When it comes to B12, you typically need fermented foods. So B12 is actually a byproduct of bacterial metabolism. And so it's important that we have adequate probiotic levels in our gut to ensure proper B12 production. And it's typically, again, found in fermented foods or also in animal products. For these reasons, we typically find iron deficiencies and B12 deficiencies a little bit more common in vegetarians and vegans. And that's why it's important for those people to increase their consumption of fermented foods to increase the absorbability of the iron and ensure that you're activating your B12 so that you're taking in the right form. As well, too, people of certain descent lack something called intrinsic factor, which is required for the normal absorption of B12. Additionally, if you're celiac, there's a higher risk for you, or if you're gluten intolerant, there's a higher risk for you of developing a B12 or an iron deficiency. And the reason for that is that the antibodies to gluten and the inflammatory reaction to gluten can actually interfere with an enzyme called transferrin, which is required for normal iron absorption. And it can also interfere with something called intrinsic factor and the production of intrinsic factor, which is required for the B12 absorption. So because of this interference, even if you're intaking adequate quantity, your body's not able to absorb it, and therefore you're going to develop these deficiencies, ultimately develop anemia, and again, all the symptoms that go with that fatigue, the dry skin, the easy bruising, potentially the tremor, the tingling in the hands and feet. So if you experience these symptoms, go get tested, because it can be a very simple fix, and your quality of life can be increased very simply by just supplementing with a B12 or an iron supplement. Now, typically for irons, because they can be constipating, I often recommend using a solution version. That ensures proper absorption, because one of the hardest things with absorbing a mineral is actually dissolving it. And so this is why I find it very important to use something that's already been dissolved, because that's the hardest part for humans in their absorption of minerals. Additionally, you can use what are called heme versions of iron. So these are typically found as tablets, and these are iron in the form it's found within your blood. And so because the human body can recognize that easily, it can actually absorb it a little bit more effectively. And adding a little bit of vitamin C can also increase the absorption of your iron. And so I do recommend anytime you're taking iron to also supplement with a little bit of vitamin C. Now, because an iron deficiency can mask a B12 deficiency and vice versa, I'll typically also recommend that when supplementing iron, you also supplement B12 just to ensure absorption. And for that, I typically recommend supplementing with a version of B12 called Methylcobalamin. And the reason for that is it's the active form of B12. And the cool part about it is if you stick it under your tongue, you can actually absorb it right in your mouth, directly into your bloodstream, and you don't need intrinsic factor for this absorption to occur. So if you do struggle with producing intrinsic factor, you can kind of bypass that mechanism by using a sublingual version of methylcobalamin or methyl B12. So that's a very easy way to supplement it. And again, I typically recommend 1 to 5 milligrams of B12 a day, based entirely on the fact that there's no known toxicity with B12. So it's a very safe supplement to take. Iron, there is a little bit of a risk for, so I typically don't recommend supplementing it unless you've had a test to show you're iron deficient, just because too much iron can be toxic. So it is important, just go to your doctor, get checked out, ensure you're iron deficient first, then supplement with typically a solution version of iron, just to ensure maximum absorption, and that can help cure your anemia issues. So I hope you've learned a little bit about anemia today, something you can take home and use yourself and hopefully overcome your fatigue, possible skin issues, nail issues, tremor, tingling, all those symptoms that can be anemia. So if you like this video, please check out our channel. You can subscribe. And if you have any questions or comments, please post them below. And always remember, knowledge is health.